I have to choose which patients will get the greatest chance to survive. That's not how it should be.
Så om någon ropar på mig i korridoren så har inte jag tid att svara den patienten. För att jag är på väg till en annan patient som är sjukare.
For the last decade, Stockholm-based doctor Akila Wad and nurse Jenny Patterson have been on the front lines of the healthcare crisis engulfing several parts of Europe. After years of underfunding, the COVID-19 pandemic, and a fast-aging population, health systems across the continent are facing a potential breaking point. Surges of flu, COVID, and respiratory viruses filled emergency rooms this winter, while medical professionals from Rome to Berlin walked out over staff shortages and pay.
Our hospitals are getting full almost every day, and it leads to a one-in, one-out situation where we have to choose between different patients that all need hospital care. We're constantly forced to break rules, break routines, and our moral compass.
The situation is exacerbated by mounting structural problems. Across Europe, spending on health was flat as a percentage of GDP for more than a decade, even as the cost of drugs, diagnostics, and treatments increased, resulting in stagnant salaries and tighter hospital budgets. While spending did jump during the COVID pandemic, much of that went to one-time and emergency costs, such as extra beds and coronavirus vaccines.
Den började innan corona och man har absolut ingen förmåga att återhämta sig efter corona. Övertiden går i taket, arbetsvillkoren blir sämre och arbetsbelastningen blir högre.
Another issue is Europe's aging population. Care for older populations is generally more expensive. In 2020, about 1/5 of the EU's 448 million people were aged over 65. That's 3 percentage points higher than a decade earlier. And healthcare workers are getting older too. According to the World Health Organization, the aging of healthcare professionals in Europe is a ticking time bomb. In France, for example, nearly half of doctors are over the age of 55. Making healthcare systems more resilient will require countries across Europe to up their spending.
Healthcare professionals we've spoken to have pleaded for money for years, but their calls have often been ignored by politicians who instead go for one-off solutions that play well with the electorate. Because fixing European healthcare is going to be expensive. According to the OECD, its member states would have to spend 1.4% of GDP to make healthcare systems more resilient, and most of this going to frontline staff.
Under the current conditions, frustrated healthcare workers might choose to leave the profession, creating a snowball effect.
Och om sjukvården ser ut som den gör idag kommer inte jag vara kvar inom sjukvården i många år till. Det kommer jag inte orka.